So in this meeting, I presented the results of the GIANT trial. The GIANT trial is the first of its kind. It's a trial that focused on older patients with metastatic pancreatic cancer and really tried to understand the best treatment approach for this prevalent and very complicated patient population that we see in clinic. The trial randomized patients that were vulnerable to receive dose-reduced chemotherapy with either gemcitabine and nab-paclitaxel versus 5-FU and liposomal irinotecan, and follow those patients for overall survival. And in addition, we looked at geriatric assessment and quality of life assessment at baseline and tried to identify factors that correlate with outcomes. And this was because it's really, really hard to know which patients in this very vulnerable patient population should receive chemo and which patient are actually going to be harmed by chemotherapy. We were hoping that looking at geriatric assessment factors at baseline and quality of life markers, we can understand how to identify those patients. So we presented the results of this assessment, and we found that at baseline, those patients that had nutritional issues, that had more functional issues, and had more and had evidence of depression actually did worse, and their overall survival was lower, as well as every single one of our quality of life measures strongly correlated with outcomes. Now, although this is intuitive, this is the first prospective study to show this in a vulnerable patient population with metastatic pancreas cancer, and it really leads us to think about what can we do about it. Is this a way to select patients and understand who would benefit from chemo, but also can we intervene? Can we address these geriatric vulnerabilities, these quality of life challenges? Can we address them at baseline, provide supportive care, management of geriatric factors to improve the care of these patients? So those are the main take-home point, in my opinion. I'm going to add as well that on this trial, we saw a cohort of patients that actually did better than we expected with chemo. And do these factors help us select those patients that could benefit from chemo, can possibly even do better than we thought with a dose-reduced chemotherapy regimen?